so I have my MAR right here. So first I'm going to check, okay, there is 2 signatures, 2 verifications, but first I'm just going to check the patient's name. Nursing Jake, okay. I'm going to check the medication. Heparin, dose 5,000 units, route subcutaneous, frequency twice a day, and I'll be giving it at the 9 a.m. slot, and I see that there's 2 slots. First I'm going to get the medication. Okay, so this should be heparin, yeah, heparin, and it says here it's 5,000 units per 0.5 ml. So since I need a 5,000 unit dose, I will need 0.5 ml for my heparin. Okay, so have that ready. Before I get it ready, I also am going to check if it's expired. It is not expired, and it says here they have no known allergies, so they are not allergic to heparin. So I have that ready. Okay, I have my 3 ml syringe, and I also have my blood fill needle here with me. Actually, before I do, this medication will be for their DVT, so the deep vein thrombosis. It is an anticoagulant, and it works by preventing prothrombin into becoming thrombin and preventing fibrinogen to fibrin. And some side effects that I'm going to be looking out for is bleeding. So I want to check before giving this medication their CBC. So I want to check their hemoglobin, their hematocrit, their APPT, their platelets as well, because I want to make sure they're not bleeding. I'm also going to do a quick skin integumentary before giving this medication, and let's see. So other than that, yeah, so some adverse side effects is anemia, thrombocytopenia, and what's the other one? Yes, and hemorrhage, yeah, the hemorrhage. So before I do, I'm also going to look at their the PDM. So heparin, you see that? I'm going to check, am I allowed to administer this medication? So first, it is subcutaneous is allowed. It may be administered by nurse or student nurse. That is me. So perfect. I'm going to check if there's any extra information about giving this subcutaneously, and it doesn't say there's any special information, and it says here 5,000 units subcut every 8 to 12 hours, which is perfect. I'm only giving 5,000 units. Okay, so I've checked that. Okay, now I'm gonna prepare. I'm just gonna double check. Okay. So I'm going to first clean my vial for 30 seconds and then let it dry. So while I let that dry, I'm gonna get my syringe. Just gonna do some twisting. Okay. So since I need 0.5 ml, I'm just gonna make sure it's not sticky. So 0.5 ml. Well, there's some fluid inside. Shouldn't be, but yeah. Let's see there. 0.5 ml. I'll be injecting it in. Perfect. Injecting the air in.
Let us know right away any signs of bleeding in the gums.
Okay, so I pulled enough fluid. And you just do the scoop method.
Yeah. Report any of the signs.
Put it on the desk. Just gonna get rid of the air bubbles. Hold on a pen. Oh, I got that ready. Okay. So there is excess fluid, so I'll be actually pushing this over the sink, but let's pretend there is a sink here. But for this demo purpose, I'm just gonna put some back into the container. 0.5 ml. Okay. I have 0.5 ml. Just gonna push it in against the table. Okay. Now I got that. I gotta pull back the plunger to make sure there's nothing left in the needle. I'm gonna get my. So this needle is a 25 gauge and 5/8 inch needle, which is perfect because the range for subcutaneous is 25 to 31 gauge and half to 5/8 to half to 5/8, yeah, inch needle. I have that ready. Open. I'm just gonna get rid of this. Twist it on. Okay. Now I'm gonna push it back up. Make sure there's no air bubbles. half an ml. There you go. There's no air bubbles. Half an ml. So now that I have my medication ready, I will need to make my label immediately. Let's move this aside. Okay. So, patient is Nursing Jake, NJ. Drug name is heparin. Right dose is 5,000 units. 1,000 units. Volume is 0.5 ml. Concentration 5,000 units per 0.5 ml. The current date and time is March 10, 9 a.m. 9 a.m. My signature is JHUMNS2. I'm gonna write right here. I'll be reading sub cut to make sure I see that. So now that I have that, I'm just going to pull this out, attach this to my needle. Okay. So while I have that ready, I'm gonna do my second check. So, right patient, Nursing Jake. Right medication is heparin. Right dose is 5,000 units. 5,000 units. And I see here it's 0.5 ml because it says here 5,000 units per 0.5 ml. So I needed 0.5 ml. And on my syringe, I have 0.5 ml. And next is right root, subcutaneous. Yep, I have correct. I have the right syringe and needle size. Right time and frequency, twice a day. Twice a day. Current time is 9 a.m. so I can put it in the 9 a.m. slot. Perfect. Okay, so now that I've done that check, I'm gonna go to the patient's table. I'm gonna first put these away. Okay. And I have my con buds there. I just need to do this. And yeah. Hello. Okay. Hello. First, I'm gonna wash my hands. Hello, my name is Jannah, and I am a nursing student. I'm gonna do a quick safety check here, and I wash my hands. No hazards on the floor. Perfect. Yeah. So I'm gonna first verify the patient. Hello. I'm just gonna quickly check your name. Okay, Nursing Jake. FIN number 312-654-987. 312-654-987. Okay. Can you tell me your full name? Nursing Jake. Can you tell me your date of birth? See, perfect. And are you allergic to anything? No known allergies. Perfect. Okay. And yeah, so I have verified the patient. So today you're going to be receiving your heparin medication, but before I give it to you, I'm going to just do my third check here by the side. Okay. So, I have my medication here. So, heparin. Okay, so right patient, Nursing Jake, right medication, heparin, right dose, 5,000 units, it's 0.5 ml, and it is 0.5 ml on the syringe. Right route is subcutaneous, right time and frequency, twice a day, and the current time is 9 a.m., so I will be administering it at 9 a.m. Today is March 10. Perfect, that is my third check. So, some information about this medication is it is for your DVT, your deep vein thrombosis, and it should help prevent clotting. Some side effects you may get is bleeding or fatigue from this medication. But if you have any lesions or cuts in your mouth, on your skin, make sure you notify the nurse because you are at risk for bleeding since this will prevent clotting. So basically you will bleed a lot easier. So before I give this medication, I'm going to do a quick vital sign check. I'm going to also check their skin, check their mucus, their mouth, any bleeding areas. And of course I have checked their CBC, checked their hemoglobin, hematocrit, platelet, red blood cell. And yeah, so now that I've checked that, I'm going to get ready to give the medication. First I'm going to wash my hands again. I'm going to put my gloves on. Okay. Oh gosh. So this injection is a subcutaneous injection, so it'll be in your abdomen. So it's basically going to be injected into your fatty layers. So I'll be injecting it in your abdomen. If you have a preferred side, you just notify and tell me. So I'm just gonna put this over here. So I'm just gonna lift this up and I'm going to just check where you would like it. Oh, they don't have an abdomen. Okay, I'll just pretend. So let's say your umbilicus is here, and I'll be injecting it just at the side here at your abdomen to make sure I get to that fatty layer. So right here, right beside. So your umbilicus will be right here. I'll probably inject right here. Okay. So now that I have that ready, this one. So I'm going to wipe the area in a circular motion. I'm also gonna let that dry. Perfect. Okay. So while that dries, I'm going to be pinching your skin. This should not hurt. It is a relatively short needle. You may feel a little bit of a pinch, but it shouldn't be too bad. So I have pinched about 1 inch. Yeah, that's 1 inch. And so I'm going to open my needle. I'm going to inject it at a 45-degree angle because this is about 1 inch. Here. There you go. I'm going to stabilize it and I'm going to inject it. Perfect. Okay. Okay. Now I let go afterwards. So after I do that, I will actually throw this out in the sharps container, but for demo purposes, I will be using it again later. So so I have removed it. I'm going to remove my gloves. I'm gonna throw it out. I'm gonna wash my hands. Okay. So if you feel any fatigue, or if you feel like you are bleeding anywhere, make sure you notify the nurse after giving this medication. Oh, I don't have a. Is this gonna work? Current time is okay. It works. Current time is 9:05. JHUMNS2. Okay, perfect. So I have that marked on my mark. Before I go, I'm just gonna do a quick safety check. Before I leave, I'm gonna wash my hands, and I'm gonna make sure I document your vital signs, your blood pressure, and making sure I I write down what I checked on your CBC levels, and and make sure your call bill is right by your side. And if you experience fatigue, bleeding, make sure you notify the nurse. Done.